name is Mike Lang. I'm the CancerBridges Survivor Network Coordinator, and I am here with Dr. Wendy Demark-Wahnefried, who's from Alabama and has been a registered dietitian and researching cancer and nutrition for the past 20 years. So a whole lot of a wealth of knowledge, and we just got to listen to a really great lecture that Wendy gave, and if you haven't seen it yet, go to the educational video page and you have to watch it. So there's a lot of great information in there. But one thing that you said during your lecture was very, it hit home for me because I did the exact same thing. And so you mentioned that sometimes the first thing that a cancer patient does when they're first diagnosed is they hop in the car ride from their first appointment to go home, and they stop off and buy a whole bunch of supplements and just start taking all sorts of nutritional supplements. I don't know if you guys did that, but that's exactly what I did. After my first treatment, is I went home and bought a shopping cart full of supplements and started taking them. And so I guess a really common myth is that I can just take any supplements and it's not going to harm me, because it's nutrition, it's good for you. And so what would you say to those people who think that you can just take any supplements, it's not really going to do anything wrong?
Yeah. So you have a very common misperception. And so don't feel bad. A lot of people do. In fact, it's the number one thing that cancer patients do in dietary change. So they take these supplements, but as we find out, study after study, is that people who don't need these supplements, who are actually already well nourished and can actually put themselves at risk because they are having too much supplement. And that can boomerang and cause higher cancer, whether it be cancer risk for either a second cancer or progressive disease.
Wow. See, that blew my mind when I first heard that, because I didn't think that was possible. I didn't think that actually when you're really well, you've got enough nutrients in your body that taking more would actually damage or cause damage.
Yeah, it's a common misperception. People say, well, this vitamin, if my body doesn't need it, I'll just pee it out and it'll be expensive urine.
Yeah.
But that's not the case. And
what are some studies, I guess, that have shown that? And how did the research community come to that, idea?
Well, they started to do new supplement trials in people that were either at risk for cancer or cancer survivors. And there is a fairly famous study that has been done in Quebec here in head and neck cancer patients. And that study was looking at vitamin E and beta-carotene. And what they found is that those people that took the supplement actually had higher rates of recurrence and higher events. So,
wow.
It is incredible.
It's sort of counterintuitive. You sort of think, taking nutrients in, that's got to be good for you, right? But I guess.
Yeah. Now, if you wanted to play it safe, it'd be better to eat a healthy diet. Mm-hmm. So that's kind of what the message is.
Yeah. So and you also mentioned something else that if you do want to take a supplement, it'd be good to go get tested first. Do you want to just talk a little bit about that?
Yeah, well, I think if people are concerned about their diet, they don't think that they're eating well, to actually meet with a registered dietitian and tell the registered dietitian will sit down and do a what's called the dietary recall. Find out what the patient's eating and plug it into a database and be able to find out what they're deficient in. That's one way. And then there are other ways to look at the blood to see if it's adequate as far as B vitamins, iron, vitamin D, for example. So these are very easy. They're maybe not easy ways, but before a person starts taking a supplement,
it's a good place to start.
Exactly.
Cool. Great. Well, thanks so much, Wendy. I really appreciate you spending some time with us. And, just to summarize, I think don't go out and just randomly start taking supplements. Know what you need first before you do it. Go to a registered dietitian if you are going to take supplements. But apart from that, just getting your nutrients from good food is the best way to make sure that you've got the right nutrition.
That's it.
Great.
Good.
All right. Great. Well, thanks again, Wendy.
Yeah.
All right. We'll see you guys later. Bye.
Bye-bye. I'm not gonna